Good morning. Y buenos días. I'm Susan Scrimshaw, and I'm a co-chair of the IOM's Global Forum on Innovation in Health Professional Education. But I'm really excited because one of the founding co-chairs, Afaf Melez, is here today. And it was a wonderful surprise to see you here this morning. But this forum wouldn't exist, I know this, without Afaf's energy and drive, which means that the workshop would never have been held and we wouldn't be here today. So we owe you a lot. And the forum has sponsored a workshop on empowering women and strengthening health systems through nursing and midwifery investment and enterprise. And we're here today to discuss the report of this workshop, its implications, and I think most important, how to continue to communicate and build on this report. And I want to begin to frame this with a story. You know now I always begin with stories. I was working in Colombia, in South America, working with a physician at that point in the Ministry of Health and Family Planning. And he talked to me about the year he had spent doing, it's called the Año de Provincia, the rural year, that if you get your education through the national health system, you owe a year of service. And people go out and live in little villages and do health care. And so he went to his village, and he said within a day, the village midwife came to him. And she was a traditional midwife who then received some additional training from the Ministry of Health. And she said, "Welcome, and I'm the midwife, and we're going to work together." And he just sort of looked at her, and he said, "No, we're not. I'm the doctor." And a few weeks later, he realized that nobody in the village would have anything to do with him. And he also realized, of course, he wasn't seeing any of the obstetric or gynecological issues, and he went to the midwife and apologized. And he told me that that taught him a lesson, that he couldn't do his work without her. And he said, "I also realized I was there for a year. She was there for her life and serving in that village." So there's been, for me, for many, many years, I'm a medical anthropologist, so I spent a lot of time living in little villages or in low-income communities in urban areas, that there's been an issue of how we value, accept, and support nurses and midwives. And I've seen us go back and forth over time, and I think, Ruth, in terms of the number of years you've been working on this, and Afaf, it's gone back and forth. You know, there'll be a period where sort of midwives are in, nurses are in, and then there'll be a period where we get back to the sort of hyper-medicalization of everything, and they're out. So the whole acceptance and support has been uneven. And the issues around training and education and involvement of nurses and of midwives has been uneven. And at the same time, we're in a time of enormous change in the health professions. And we talk about this in the report that was issued in Lancet on the health professions for the 21st century, that we've had these rigid silos of health professions, particularly in the medical profession, and that the ability of nurses and midwives and physician assistants and many others to practice has continually changed, and the technologies are such that they can do much, much more. And we've been grappling with not just physicians, but conservative health systems, being able to allow that to happen, being able to allow a flow between the silos and to allow the professions to be more relevant in today's world. So I see what I would call a cognitive dissonance between what nurses and midwives do versus how they're understood, perceived, and respected. And so we're here today to talk about reframing ways in which we think about nurses and midwives and how to organize their work and how to value them differently. And this is not a new problem, as I've just pointed out. But today, we're going to talk about how the workshop report advances the way we look at this challenge. And I was particularly impressed. I thought it was so innovative and impressive, and I congratulate you and your colleagues, Marla, on this workshop, that you were tying this important work that nurses and midwives do, which has been discussed for many years, but you're linking this to the empowerment of women. And to link these is highly innovative and exciting, and I look forward to our conversations today. So it's now my pleasure to introduce Marla Solomon, University of Washington, who is chair of the Workshop Planning Committee, and you will introduce and chair a panel discussion on our workshop report. Thank you. Marla.